he like makes me laugh the whole time. So then my wrinkle, like, ah! And then he's like, okay, now we got to go fix that wrinkle.
Don't
Hi,
reveal all my
Dr.
secrets.
Well, I'm telling everybody your secret. If you're going to wrinkle up my face by laughing, then I'm going to tell everybody your secrets. Hi, Dr. Ty from Laser Clinique.
Thank you for having me, Shally.
Thank you for doing this. I know you're in the middle of your day and you are like crazy working on people and their faces. We just had you on the show not too long ago because we were talking about with all the masks that everybody's wearing, people are doing a lot more things to their faces.
Yeah, I mean, the opportunity for getting stuff done because they're covered up is much more than any other summer that we've been doing this for 15 years.
So I was going through some of my old videos and I found the video of, I'm going to turn off commenting for a minute so I can see your face. I found a video of the microneedling that I did. And I said, you know what, I just want to share this with everybody because it's something that I do often. And then I wrote on there on the screen, microneedling with PRP. And then I open my inbox and I just get message after message after message of what is it that you're doing to your face? So I said, let me just quickly pop on here so that you can explain it because you're the doctor and you explain it better than me anyhow.
Well, microneedling, I think it's become quite popular in the last 5 years. It's ideal for people who can't afford the downtime, number one. What we used to traditionally do with fractional laser resurfacing that required 7 days of downtime, I can achieve some of those same results with the microneedle device, the ones that are FDA approved. We use the one by Skin Pen. And then when you combine PRP, which stands for platelet-rich plasma, you get much better outcomes that addresses pigmentation, skin tightening, acne scars. It addresses tone, texture, and I think, I mean, you could explain all of the benefits that you have experienced with it, but I think from my perspective, it really makes a difference, and we're using the power of the patient's own blood to achieve that.
It's the one thing that, you know, like I'm totally obsessed with, right? Because I've always been a big stickler. Like I don't want to, it's okay that we're going to age. I've accepted that. But how do we do it like gracefully and just do it softly and just like soften it? So it's the one thing that I was introduced to that I got like super obsessed with because I really, really saw the difference. Like every time I would get it, a few days later, I'm like, oh my gosh, my skin, I love this.
Yeah. I mean, usually results are more visible. So let's go through it. The treatment takes about an hour. So when you first come in, we draw up a couple vials of your blood. Doesn't hurt. It's not scary in any way. Then we use a specialized centrifuge to separate the platelet-rich plasma from the platelet poor and the red cells. We extract the platelet-rich plasma so we can reintroduce it back to the skin. So patient's own blood, and that's showing the power of your own platelet-rich plasma, which includes the platelets as well as growth factors in order to stimulate collagen on your skin. So how are we going to get that blood in? Well, the method is a needle. We create chambers for that plasma to get into the skin. So we usually numb patients with a topical numbing that takes the edge off and makes it much easier to tolerate. And then actual procedure time is probably less than 30 minutes. What patients experience when they leave here is their skin is super tight because plasma is pretty thick. Yes. Super tight, and it feels like it's going to crack. And you'll probably be red like a sunburn red. And that usually lasts 12 to 24 hours. By the next day, I mean, you're back on the news, right?
Yeah, I am back on. You know, when I'm a little pink, I put like makeup on top of it, but it's the one thing that within a few days, you just feel it. Like I see it. I can even see it like when I put on my makeup, everything just feels and looks different. That's why I'm so obsessed with it. And then somebody was asking, like, is that blood on your face? Do you remember when you went to town, like in some areas we're trying to get rid of like stuff?
Certain stuff, yes. So because it's obviously, the microneedle is made up of 12 tiny gauge needles that spin at about 85 reps a minute. And so because of that, we may create some areas where you look, you know, they call it the vampire facial, or, you know, vampire facelift, if you will, that you look like you're bleeding, but, you know, that all stops before we send you out. We don't send you bloody out of the office.
And then this is taking care of what and what and what besides my skin looking like nice.
So besides that, usually the actual outcome is more apparent after 3 to 5 days. It continues to improve for the next few weeks, and you'll have that nice glow for a few months. We usually recommend to do a series of these treatments, anyway, depending on the ailment that we're trying to treat. A series of 3 to 5 sessions once every 4 to 6 weeks.
Yes. And that takes care of, somebody was messaging me too about like dark spots and whatnot. This helps with that.
So because it will help lighten dark spots, let's put it there. If you had a dark spot that's been there for years, well, we may need a combination of a laser as well as microneedling to help improve it. This treatment is also ideal for patients of darker skin types. This is also ideal for people who are active outdoors and can't afford the fact that they need to stay out of the sun with the laser. Well, I could technically treat them. We don't encourage you to go in the sun after this because
sun is bad.
sensitive. But obviously, if you are protecting yourself with sunscreen, hat, and sunglasses, then you're more safe.
And this helps with a lot of, I've noticed, like the fine lines and the texture of the skin, right? Absolutely. Like all of that. It just is like
opens it up. When you look at the before and afters, I think that you really can. I'm quite impressed by the amount of improvement that patients see with this combination. For people who suffer from darkening under the eyes, it helps lighten some of that. Thank you for sharing. That's a little too close for comfort, but that's all good.
Come on, let's just be real. Let's just look at the darkness. I get up at 2 o'clock in the morning. I got dark circles under my eyeballs. See that one right there?
True. Yeah. 4 kids, 4 kids and a dog. I get it.
4 kids and a dog and a husband, and you know, like I have stuff. But I love being able to find these things that I can share with people. Like when I find them, I get so excited about them myself that I like to share them with people and say, like, this has really helped me because I've dealt with some of these issues. You know, I come over there, I'm like, fix this. Can you fix this? I'm coming this week. Get ready.
Some things are a little bit more challenging, but I think we try our best to address it without downtime. I mean, you're not one that can afford it, and most people are not. Most people are active lifestyles. They don't want the significant downtime of a surgical intervention at this point. So this will kind of help offset the skin issues. And it's not just the face that we treat. We can treat the neck, the décolleté, the hands.
The hands? I haven't done my hands.
Yeah, the hands are another area. You know, the other component is people with stretch marks. We've seen really good results with microneedling with PRP for stretch marks. So, I didn't tell you about that one. Surprise!
Are you serious?
Yeah. So for stretch marks, you'll see at least a 50 to 70% improvement for older stretch marks. Because what are we doing? We're creating that chamber to restructure the stretch mark that is kind of like a scar. That's when I treat a scar on the face. A stretch mark is kind of like the scar on a body.
Oh, so you're basically like trying to like wound it again and then put your own blood back in it again to make it like heal again.
That's it.
Yeah, I should just be a doctor.
That's it. We'll give you an honorary license for a minute.
I know they really shouldn't. Okay, so what I'm gonna do is I'm going to refer everybody because I know a lot of people have more questions, and you're in like a middle of a busy day with like your clients and your patients, and you're doing all your stuff. So I don't want to take up too much of your time. So if people want to call about like the pricing and all that other stuff, they can call Laser Clinique.
Correct.
You're in San Diego.
We're in San Diego. We're in an area called Sorrento Valley, right in between Del Mar and La Jolla, right off the Mira Mesa exit, and very easy to find. You can Google us. Our number is convenience, and my staff is well versed in order to address your concerns.
Yes, yes, yes. You know I'm coming this week. Can you like fix this? Fix this?
Did I tell you I'm going on vacation?
Do not dare. So
where am I gonna go? That's the problem. There's nowhere to go.
I'm gonna tell everybody real quick before we go, and I wasn't really gonna plan on sharing this, but I'm taking some time to do that really invasive peel that you told me, because I still, from Shaden and being pregnant, I still have all these, some person mustache or sent me a message and told me nice mustache on TV.
That's not nice. That's not nice.
I'm like, dude, it's not a mustache. It's being pregnant. It's like all these dark spots.
That melasma is very endemic, and it follows a pattern. It usually follows bilateral cheeks, center of the forehead, and the upper lip. See? And it's unfortunately, pregnancy is a big culprit. Birth control is a big culprit. Sun exposure is a big culprit. So all of these can cause, it's a form of hyperpigmentation called melasma, and this Cosmolon peel is very effective.
I'm gonna do that. I'm gonna do that soon. I have to take time off for that, though. You told me to take time off for that.
You need some time. You need some time. And I don't want you to do this and then, you know, have like a dance party outside with your daughter, please.
No more sun. No more sun. I am learning at this age. If I knew then what I knew now about sun, oh my gosh, the things I would have done in my like 20s.
You know, I hear a lot of arguments from patients and others that, what about the vitamin D? What about the vitamin D? I'm like, listen, yes, vitamin D synthesis through the sun is very important, but you don't have to get it just on your face. You have your limbs to get vitamin D exposed.
Yes, yes. I just put the hat on. I'm really good about putting SPF on and my glasses, and you know, and I take a vitamin D thing. But I still go in the sun. I just don't let my face go in the sun as much.
I'll tell you one thing, just from my own perspective. I started taking vitamin D3 about 3 years ago, and knock on wood, I haven't gotten sick once. So I think there's something to be said about that. Vitamin D3 is very important, especially then.
You take it daily?
I take it daily. I've upped the dose. Now I take 5,000 IUs daily, and I'm good so far.
Well, knock on something. We don't want to like jinx all of that.
We're good. I'm good.
But it's these little things make a huge difference.
I mean, when it comes to skin stuff, it's important to protect your skin. No. And most of your damage happens in your teenage years, and it starts to present itself when you're in your 30s and 40s.
Yeah.
So that's the challenge. And then by the time you're 50 and 60, you're like, I need surgery. But even with surgery, it doesn't address your skin. You still need to address the skin component. Yeah.
See, so all you youngin' people, if any youngins are watching right now, see what happens when you're like later in life. Hey, youngin, come here. Youngin, come here. Come here, youngin. Let me tell you what mommy wishes that she did when she was younger, when she was your age. You want to come say hi? Look who's here.
Hi, Shyla.
You being shy? No. I will encourage her to put on a hat and wear SPF and take care of her skin, drink lots of water, and do all of that stuff. Because genetically, she's going to pick up what I gave her anyhow, right?
Usually, but you know, she'll take more after dad's side.
Oh, really?
Your boys will take after 70% of the time, from a DNA standpoint. Your boys will take after you, and your daughter will take after Brucey.
Did you hear that? Did you hear that? I think that made her happy. I made her happy. Oh,
that's awesome.
I love it. Well, I appreciate you taking time out of your very busy day to explain. So all y'all who sent me those messages and asking me what I do to my face that I'm obsessed with, there. It's called microneedling with PRP.
Correct.
They take my own what? They take my own blood out, and then they make the little plasma, and then they put it back in my face, and he takes this needle and he goes. Bzzz.
But does it hurt?
No, actually it doesn't. And I'm a baby.
Yeah.
Don't tell everybody how much I squeal when I come there.
Yes, we usually confine her to a space where no one else is. Scare the rest
Thank
of our
you.
staff and patients.
Thank you for letting everybody know. But it actually does that, especially the topical thing. Like you don't feel anything.
Yeah, we kind of compound our own topicals, so really
Yeah.
useful in that respect.
I think the scariest part is when I come home the first time or second time, the boys were old enough. They looked at me and they go, "Mommy," they were just standing there. They did a double take. They go, "What happened to your face?" Because it was like the plasma was stuck all over it. It was flaking. Yes. Yeah.
So that's one thing I forgot to mention. We don't want you to wash your face until the next morning. So
yes.
You have to leave that plasma on in order for it to get absorbed. And that's the worst part.
Yeah, that's the worst part. To sit there with your face cracking and then to be like that all night, it feels so good the next day to like wash it all off. But it's worth it because you just do it every like few months and it's good. Yes. Yes. You want to say hi?
Hi. She done with school for the day?
Oh my God.
It's recess.
All day is recess in this house.
Recess. Got it.
I'm telling you, it's so much easier to be in the office where you're sitting right now than being at home.
Oh, yes. I sat 2 hours for one kid, 2 hours for the other, and I was like, nah, this is not working out for
You're
me.
like, I'm out.
All right, good luck, mommy.
Bye, Mom.
Yeah.
Wait, shoot, I'm Mom.
I know. It's challenging, for sure.
Well, Dr. Atai, his name is Dr. Atai. It's called Laser Clinique. If you're there and you happen to be in the office anytime that I'm there, please don't acknowledge my presence and don't tell anybody when you hear me screaming.
Well, you come in with a hat and sunglasses so no one recognizes you.
Dude, people recognize me with no makeup on and one of those masks on. I could be out and I look like this. And I have a mask on. They're like, "Oh, Shally." I'm like, "How do you know? It's like here, dude. It's here."
Yeah, it's the eyes. It's the eyes. It's those lashes. Those lashes.
It's the weird. No, but see, look, I even take them off. Look, let me just take them off.
Enough already.
Okay, I'll be there.
But that's a little excessive, my friend.
I'm just saying. Hey, I have to take these off when you do all that. Anyhow, you said you take these off.
I know. That's it.
Just keeping it real. Just keeping it real. I like to keep it. If you bring the bar down low, then the expectation isn't like all that.
It's not challenging. I get it.
I'm looking forward to seeing you a little later this week. Please get your whole arsenal of stuff ready.
Yes,
there's quite a bit of work that needs to be done because see, this is what this is what homeschooling has done to me. You see this?
Yeah.
You see this? You see this right here? You see this?
Repairable. It's all repairable. It's like you go to the car repair shop, you get your tune up.
I'll be like, beep, beep. I'm here for my tune-up. Beep, beep.
Tune-up time.
Exactly how I'm going to walk in later this week. Dr. Atai from Laser Clinique. Thank you for your time. Get back to your patients, and I'll see you later this week.
All right. Have a good one. Bye.
Bye. He is the funniest.